Hey everyone, my name is Molly Solomon, and this semester I worked on an evidence based practice research project on reducing hospital readmissions for women of higher BMIs related to surgical site infections after C sections through improving and expanding patient education. Just for a little background, obesity is a risk factor for developing a surgical site infection after a C section because of the higher potential for comorbidities like hypertension and diabetes, needing a larger incision, and slower wound healing from decreased perfusion of subcutaneous fat tissue. Currently, a lot of the research on this topic focuses on interventions to perform before and during the C section, and there is limited research on how to improve the care to prevent infections after the procedure is completed, which would be more relevant to the family place unit. So, this is definitely just a jumping off point and beginning to do further research and ask more questions. So, some interventions that places have found to be successful are as follows. Mayo Clinic facilities have developed a safety bundle to prevent and treat surgical site infections. Within the bundle, it includes a lot of preoperative and intraoperative interventions like different skin preparations and methods of hair removal, but it also includes postoperative interventions like removing the dressing earlier and expanded patient education for how to care for the incision site and what to look for as an early sense of infection, as well as following up with the patient after, or if that's not feasible, making sure that the patient understands to follow up with their provider soon after discharge. This resulted in an infection rate of 6% dropped to an infection rate of 1%. So, some smaller changes that other facilities have found to be successful are also with patient education. It was studied that patients are more likely to follow and comply with their teaching when they fully grasp and understand it. So, using multiple different formats of education can be helpful. In Pittsburgh, at facilities there, they studied having patients use a small mirror to look at their incisions and become more confident with caring for it, especially for someone who doesn't have a background in anything related to the medical field. So, this also supplements that with using pictures, text, and oral education. Overall, this is helpful for an obese woman to potentially remind them to lift up any excess tissue, remember to inspect and clean it. And this is also just helpful for anyone in a higher risk factor group with just more patient education. The teach back method can also be helpful in seeing where there are still gaps in education and then filling those gaps as needed. If patients become more aware of the earlier signs of infections, then it may work to reduce hospital readmissions by seeking care earlier where it may not require hospitalization. Thanks for listening. I hope this was helpful. You can see my poster for more information. Have a great rest of your day.